I said, some things changed. And then 3 months later, I saw a video of you telling that 3 months after the shot, we don't have more bifidus or bifidus. I don't know how to say in English.
Right.
And so we didn't have, and then I realized that even COVID leads to inflammation of the gut, and they don't have more bifidus. And then I said, and then I looked the probiotic that I gave. I just took randomly, I pick up any probiotic. There was 3 types of bifidus. And I said, how lucky I am. That explains a lot. But while I was watching your live with Macaulay, you said that it's very difficult to restore the microbiome. What I'm doing here is checking all these patients with these symptoms. They have 0 bifidum. I can check this. And I learned with you that what matters is not the bacteria, but is the diversity that makes people healthy or not. But when I order to study the microbiome, I want to know if there is bifidus or not, because that was just a simple idea. And then when I start to hear you, I see that I was very lucky, because the subject is extremely more complex than this. So I like to tell you that I'm having results. I sent you the final paper, because they sent to me to make some reviews, to make some small corrections, and then I sent to them. I think they will accept, because is everything very well tied, is everything very well explained. Is I report 5 cases, but I sent to you just to be happy, and I will let you talk. But before that, I strongly suggest, because I'm here in my office, I have my private clinic. I was a pioneer on steroids. I create an oral strategy protocol that saved a lot of people when Belém do Pará, that is a town here in Brazil, was in collapse. And this protocol is spread all over, because we both know that there was always a treatment, and we are always suppressed down. I was lucky, because I see very important people here in Brazil from both sides. So when they get afraid, they try to suppress me, but not too much, because if they need me, I was here. So I strongly suggest that if I send you the paper, but you make more a paper with clinical trials, trying to do this intervention, because I saw another paper in which they gave bifidum, and they perceived that a good response. But in my case, I'm not perceiving a good response. They came cured, and this makes the whole difference. And then, before you talk, I like that to discuss all this that we went through during this pandemic, and tell people to be awareness that there is a lot more than what they told them. So how can you help me? Why I'm having such outstanding results? I saw more than 100, and I don't think that's just a simple solution. Maybe there are some bacteria that they are stiff in the gut, and bifidus might be one. Then when you get in, she organizes all microbiome. This I'm guessing, I don't know. So, ladies and gentlemen, Dr. Sabine Hazan.
Thank you, Roberto. Yeah, what you observed is essentially you, with a gut feeling, got to heal your patients because you practice the art of medicine. And I think that's the importance here, right? So we all are artists, and we all know, certain things that we have a feeling that we've learned over the years of how to heal patients, whether it's holding their hand and giving them confidence that they're going to survive, or whether it's giving them the right combination therapy because you know the mechanism of action, and therefore you've had experience, right, as a physician, to know how to treat patients. So when a patient has an anaphylactic reaction, you just don't wait for them to die.
No.
The first thing you do is you pick up what you've learned in med school and you resuscitate the patient. So what happened during the pandemic was a bit of a destruction of that ability of us as physicians to intervene in a crisis situation. And when the government or any politician is telling me how to resuscitate my patients, I have a problem with that because they do not know how to do CPR, right? They do not know how to give what drug to give for VTAC, SVTAC. They have no idea what a rhythm looks like, what a QT interval looks like, etc. So, we've all trained, and you have gray hair like I do. I just hide mine. But the fact is, we've all trained for a long time to learn this, right? We've gotten our training on the front line of medicine, trying different things, trying a product, trying a formula, listening to each other, right? Training, listening to other doctors, hearing what does Dr. Peter McCullough do? What does Dr. Pierre Corey do? What does, other doctors in South Africa, in Australia? And then we innovate. That's the beauty of medicine. I remember Dr. Marks at the FDA said, well, we have to let doctors practice and give them guidelines, but we cannot also suffocate the innovations. But what did they do during the pandemic? They suffocated the innovations. They stopped us. Yeah, and they stopped us from resuscitating our patients. You have a patient that's crashing, having an anaphylactic reaction. You don't wait for someone to tell you to give epinephrine. You know what to do. You recognize the anaphylactic reaction. How is COVID any different? These were patients that were, in my opinion, having an anaphylactic reaction. They were having cytokine storm. Those cytokines went through the body, stopped them from breathing. Our job was to suppress the cytokines, to decrease the cytokines so that they could breathe again. The biggest discovery during the pandemic, so if you go back, I was writing the protocol with Dr. Tom Barodi. Dr. Tom Barodi is the father of fecal transplant, who's innovated hundreds of patents for various medical conditions. He's worked with a lot of pharmaceutical companies, from Merck to Sanofi Pasteur to multiple companies. And he's always been an innovator. When we started during the pandemic, I had found COVID in the stools of patients, clinical patients, because I was the first person to basically, go on the front line and say, I need your stools. I need to examine your stools to look for COVID. So when we found COVID in the stools of positive nasal swab patients, positive PCR patients with positive PCR, we basically realized that if COVID's in the stools of those people and it's in the stools, what is the virus doing to the microbiome? And what does the microbiome look like in people with severe COVID compared to people that are exposed to COVID and never got COVID? Think about myself. I'm exposed to hundreds of patients. They're coughing on me. I'm breathing. Why didn't I get COVID from those patients? The answer lies in your microbiome. And the answer lied in your microbiome. So, science is a discovery. It's really stepping into the wilderness, seeing something, right? Like you saw, your patients are working. And now you're asking yourself, how did I do it? What happened? What was the mechanism of action, right? That was the same thing for me. Finding COVID in the stools was the beginning. That basically said, okay, well, that's interesting. How come if I'm giving a combination of medications like hydroxychloroquine, Z-Pak, vitamin C, D, and zinc, the patient is improving severe COVID? What is happening to the microbiome, right? What we discovered is the virus was removed the virus was present before treatment with hydroxy, Z-Pak, vitamin C, D, and zinc. And then after treatment, the virus disappeared. So right away, we said, well, that's probably how it happens, right? That the treatment is working. It's probably killing the virus. What we also noticed, unbeknownst to us, and that's why it takes courage to step into treating patients and seeing for yourself, we also noticed that hydroxychloroquine and azithromycin killed the microbiome. Now remember, these people already started off with a depleted microbiome to begin with, right? They lost a very important microbe called bifidobacteria, which allowed the virus to come in. Now, on top of that, the virus did its damages, but then the treatment does its damage, right? So, how do you fix the gut knowing that you started off with a dysbiosis, an imbalance in the microbiome? You killed the virus that entered because of that dysbiosis, that imbalance in the microbiome. And then when you replenish the microbes, you start seeing healing, right? And the thing is, after treatment, there is also a demolition, right? So think about drugs like Paxlovid. What are they doing to the microbiome and the virus? What is, ivermectin? So we looked at ivermectin, doxycycline, and what we noticed was ivermectin was a different pattern than hydroxychloroquine and Z-Pak. What was so interesting for me was that I was doing the clinical trial for hydroxy, Z-Pak, vitamin C, D, and zinc, and I was treating patients, and I was on a clinical trial with the FDA where it was a placebo-controlled trial. So some of my patients got a sugar pill instead of hydroxychloroquine and azithromycin, and the others got the real drugs. I did not know who was getting what. And at the same time, I was running a couple of other clinical trials for COVID. So, and I also was writing the protocol for ivermectin, doxycycline, vitamin C, D, and zinc. What happened was when my patients were crashing and I didn't know if they got hydroxy, Z-Pak, or the placebo, I didn't want to double dose on hydroxy and Z-Pak because then in my mind, I was thinking, well, I'm probably going to keep killing the microbiome. That's probably not a good idea. Maybe I need to rebuild. So I switched gears because I didn't know those people that were treatment failures. I didn't know what they received. So I gave them ivermectin, doxycycline. My first patient that crashed on me went from like day 4, he was on my protocol, placebo-controlled trial with FDA watching. And basically all of a sudden he crashes on day 4. He's on his way to the hospital. He had ivermectin on hand. I said, why don't you stop and get some greasy French fries and have the ivermectin, all 36 milligrams. His oxygen was in the below 70%. He arrives at the hospital. His oxygen is back to normal. He's breathing again. What did I observe during that time? Ivermectin did something, right? Because what did I do? I didn't do anything. The guy's oxygen was low the whole time because I was watching. People say to me, well, it was probably just an incidental finding that one time. But I was watching that patient on my cell phone because I was freaking out and I didn't want to lose anyone on the pandemic. So I'm watching this guy's oxygen. I'm like, no, put it back again, put it back. And it wasn't going. And then after he had the French fries and the ivermectin, all of a sudden he starts breathing and then his oxygen starts climbing up to the point that he reaches the hospital. His oxygen is 92%. They said, whatever that doctor did, follow her because you're going to be fine. He went home, took the ivermectin, doxycycline. He was cured. So, and this was not a simple guy. This was a guy with kidney problems, diabetes, overweight. This was not your sports figure, right? Or an athlete. This was major comorbidities. So the fact that he survived, that gave me confidence because then I said, wait a minute, there's something I did. What did I do? So the first thing I did is I went on a search on PubMed and I looked up ivermectin. And then I went on Google and looked up ivermectin. Come to find out, it was in the same phylum as bifidobacteria. So that's when it clicked on me. And the first thing I did is I called Dr. Barodi and I said, you know what? I figured it out. I know what's happening. They're brothers and sisters. Bifidobacteria is probably the sister, and the streptomyces, the ivermectin is probably, which is the bacteria, streptomyces, is probably secreting some secretion to feed the bifidobacteria and probably increasing that bifidobacteria. So right away, my wheels started spinning and I said, we need to start testing just patients on ivermectin before and after. So we started testing and we noticed, in fact, I was the first guinea pig, by the way. I was the one, I took ivermectin and noticed my bifidobacteria went up. When that happened, that's when I started doing combination therapy. For the really, really sick, I was giving hydroxy, Z-Pak, vitamin C, D, and zinc, and then I would add ivermectin if their oxygen dropped, right? So it became a combination treatment, and we all started talking about it how it wasn't just hydroxy, it was truly the art of medicine at its finest. And
Yes.
so to stop that would have stopped that discovery. So what we learned is that we learned that ivermectin does increase the bifidobacteria within 24 hours. And then it made sense. So I published a hypothesis that said maybe ivermectin increases bifidobacteria. Of course, it was the most read hypothesis, and then got retracted. So I knew I was on the right path. When my protocols of that I ran through the FDA on hydroxychloroquine were censored, we couldn't advertise on Facebook. When I would do clinical trials for pharma, and I would always be able to advertise on Facebook or Instagram. Till this day, I'm blocked. I cannot sponsor my page if I want to on Instagram. So if I want to advertise a video that I'm doing with you, for example, I cannot. I'm blocked and censored. So I knew I was on the right path because I said, wait a minute. Think about it. If you're wrong, they would put you on stage, right?
Yeah.
Because they would say, "Oh, let's put her on stage so she can make a fool of herself," right? But if I'm right, they don't want necessarily this truth to come out because there's no money to be made on cheap formulas. There's no money to be made when doctors are innovating in their offices. Think about the art of fecal transplant. What we do,
That's incredible.
yeah. So we do
I
fecal
did
transplant.
here
We did.
in a patient here, not before COVID. I did.
Yeah, before COVID, you could do it. And we all saw different things. Colleen Kelly saw alopecia areata improve in 2 patients. Sahil Khanna at Mayo Clinic saw chronic urinary tract infection improving. So many doctors saw so many papers came out, and now fecal transplant is part of the guidelines for gastroenterologists. In other words, the antibiotic doesn't work once, twice. Guess what? You can go to fecal transplant. But there are other opportunities. So science is constantly evolving. And so what you saw with your patients is really the art of medicine.
Yeah, I like to
And that's it.
I like to add something. First of all, this is not a coincidence. We have the same uh, thinking about how to deal with medicine, how to do our practice. But everything before happen, every solution before happen, is start from a deeply wish from your heart to solve the
Yes.
problem of the patient. It was like this when I observed that my first case of the patients from COVID, they just get sick 7 days, 5 days after the first course, the first phase of the disease. You know why? And then I understood, just observing, that what is killing my patient was the immune response. And then what I did, I gave steroids for the first time, maybe in the Western world. I gave Solumedrol, and the patient just recovered like that. And then I said, well, I have a solution. And then I did not lose one patient in 2020. We saw more than 1,000 here, and no one did go to the ventilator, to artificial lung. No one go this. No one did go
Wow.
that. And then they became so there was a treatment. And you know which was my first contact with ivermectin? I saw a paper from Australia
Yes.
showing that it neutralized in vitro the virus. So I
Yes.
said, well, I need to keep my patient close to me, because if take too long, it's more difficult to control the cytokine storms. So what I
Right.
did is, let's start with ivermectin, and then I didn't use chloroquine, because I believe that in my view, I believe that the potential of anti-inflammatory property is not as strong as ivermectin in this case. I didn't know that it works in the gut, but so I brought the patient close to me, give ivermectin, and then steroids, and then I created the oral protocol, and it was just a consequence of a wish that comes from our heart. you know, we are in the middle of a spiritual war. So
Oh, yes.
I bet that you are spiritualized because I saw your interview. I am also. And what makes us different than evil, because it's a fight between the goodness and the evil. When you think in others, when your goals bring benefit
100%.
to others, then the things happens. And so if you are a good spirit or have a good view, you look at you. Of course you can't forget you. If you forget you can't help anyone, so you need to
Right,
help
right.
you, and then you bring benefits. In the other hand, the evil does not care about others. And I just wrote a monography that called occult COVID, that COVID that they didn't tell you. The COVID that I lived is much, much different than the one that they told you, because the big mistake in my point of view was they suppress any treatment, and I knew that the treatment was effective. I knew that. And in this book, I tell everything what I see in this monography, 29 pages. And I add, I don't know if you ever, probably you saw already the speech of David Martin in the European Parliament in 2023. And
Yes.
that explains a lot. And now you see
Yes.
that there is real evil. At the first, I was so naive. I said, well, I have this treatment. Why nobody is paying attention at me? And I have this treatment. And then I went to some TV shows that were more, they were more, it's not right wing, but they were more impartial. But
Yes.
the major media just suppressed me. But they couldn't do
100%.
anything, because when you have results,
Word
you,
of mouth PR.
when you have results, you keep saving patients. Doesn't
Yes.
matter if they are telling bad things about you or good things about you. You need to keep walking with your convictions.
Yes.
So I believe that uh, the thing is coming back, and maybe we'll be able to do science again, because science, in when you ask questions, if you are not allowed to ask questions to discuss, this is not science, this is religion.
Yes.
And you
Or
need to,
politics, anyways.
yeah, you need to see who are these small people, is a minority, who want to say and control all these people, because they control with fear. So that's why, doctor, I don't know, the second time that I wish to find a solution. I'm sure that I find a solution. That's why I like that you do a paper with clinical trials. I send you the paper that I just submit after we revise it. And if you create, because I don't have the before and after microbiome, and it will support all your ideas why we have. And now I know, for instance, protocol of Peter McCullough detox, but I did it here. It's good, but doesn't solve as we are having here. When I start to use bifidus, I could perceive the difference. And there is something that people, I just asking, I'm not a scientist, I have a scientist mind. But imagine if I am seeing people who did not get the shot with the symptoms, and I'm seeing, and I know that the RNA messenger is not biodegradable in the cytoplasm, so this you produce a spike forever. But there is another thing that we need to consider. Our cells, they have half-lives, one longer than others. And when they die, the RNA goes with them, disappear. So what I'm thinking, that there is a study in Yale that they said that 700 days after the
Right.
vaccine, they still detect the spike protein. But I need to tell them that the source of spike protein might come from the gut. and not by the vaccine. How I know that? Because when I treat the gut, everybody improves. If it was the vaccine, we wouldn't have this. So
Well,
go ahead. No, I don't like
okay,
the vaccine.
so the spike protein could come from the vaccine or the virus, right?
Yes, yes,
And the fact is, when you do inject the vaccine, which is what you're injecting, is the spike protein, it does go to the blood, but the blood travels to the gut.
yeah, I know
So it
that.
is possible that the spike protein from the vaccine has traveled from the blood to the gut and
Oh yes, I
start
know that.
creating a bifidophage, right?
Yeah,
So I think the whole idea of creating a vaccine from the most dangerous part
that
of
was
the virus,
terrible.
which is a spike, in my opinion, was a horrible idea.
It
And it
was
was a
not an idea.
horrible idea.
It was like a
It was
bioweapon. It was on purpose they did this.
it was a horrible idea mainly because of the fact that it was never said, it was never released on any diseases or any other virus or any other. This was the first time that this platform was used. And not only that, but think about it, used globally. Okay, so it's it was an experiment on the whole world. Imagine if the whole world had complied and and this spike was killing everyone little by little, right? That's the end of humanity. So to me, a platform that has never come out in a clinical setting, and this is the first time you're giving it and you're mandating it to everyone. A lot of people rebelled. I don't want to say well, the term is
I
rebelled in a
understand. I
way.
understand. Yeah.
You know, they rebelled mostly because it was an impeachment on your freedom. It was, you had questions. I had questions. I was in the clinical trial business for 3 decades. My first question was, why did we stop the animal studies at 1 week? Why didn't we continue to watch these animals? Why did we kill the monkeys right after we gave a week later, right? That was my first study. The second one, why are we going so fast on the human trial, phase 2, 3 to market, right? And why are we mandating, if you remember the clinical trials, they stopped the clinical trial. There was no more placebo control because they felt, well, it's too dangerous to even, not give the vaccine to the placebo. We should just give vaccine to everyone. And and then the suppression of the problems. That was my biggest problem. Because, like I said, I've been doing clinical trials for almost 3 decades, if not more. And what I noticed, when you do a clinical trial for pharma, the FDA expects you to contact them if you see a serious adverse event. And I'm going to explain to your people that are listening, a serious adverse event, it doesn't matter if you think it's from the vaccine or not. It is whatever you report that is serious. That means a patient is dead within the first month, you have to report that. It's up to the FDA to make the decision whether it's from the drug or not. And it's up to the PI, the principal investigator, on the front line to kind of say, yes, maybe this is from the vaccine or it's not. But the fact is, the suppression of those serious adverse events was a big problem for me because I have a lot of colleagues that reported those serious adverse events and they felt that they weren't listened to. They felt that it went on deaf's ear. And so, that was as a clinical trial doctor who has done a lot of clinical trials for pharma, that was the number one, was why are we not paying attention to serious adverse event? At least, put a black box warning, tell people, well, we've noticed some cardiac problems. We've noticed some people died suddenly. Report it so people can make an informed consent. Here's the other problem. Informed consent was not done properly. It's a fact. People were getting vaccinated. They didn't get consented properly. They were getting vaccinated in a pharmacy. Nobody told them the side effects. I have a friend of mine who ended up with a pulmonary emboli right after the vaccine. She was on the birth control pill. Nobody told her there was a risk of hypercoagulability from the vaccine and the birth control pill. She
Doctor,
didn't get informed consent.
doctor, it wasn't the vaccine for COVID, but the COVID for vaccine and social control. That's why there is a big plan that we know. I wrote in this monography, and of course, the vaccine I study with you, I learn with you that it creates a leaky gut, a dysbiosis, because the expression of spike trigger a lot of inflammation. And I believe, this is just an idea, you're gonna prove later, but it's just an idea. I believe that this new last COVIDs like Omicron, this nowadays, or even from the 2023, there was Philip Macmillan, they called the iceberg storm COVID, because the symptoms of the acute infection are so mild, so this will be over the ocean, and below the ocean the other 3/4 all these symptoms that are consequence of dysbiosis. And if we have them, if they have a potential bacteriophage action, they keep replicating with no bifidus, and this create a leaky gut with absorption, a lot of toxins plus the spike, and then, as you know, go up there and then come back. So I believe that there is a synergy between the shots and this dysbiosis. And I believe more, I'm not sure if I am right or not, but I believe that all this increase in death all over the world with all different disease, but the source of this disease is a spike circulating in small vessels, in my opinion. I believe that this is associated with this dysbiosis. But they didn't count on us. You're gonna prove this. I'm gonna show I send the article for you. You're gonna prove this, and the treatment, we have a problem. Because I don't know how cheap it is, but because it's cheap to just replace something and give 5 days, 7 days of a course of antibiotic, not to kill all the good bacteria, just a small period, and then we give nattokinase, we give ivermectin, and the results are outstanding. So they didn't count on us. I hope that you'll be able to design this study, or maybe make it even better, because what I did, I just published some report cases. I'm just gonna tell one that was incredible. You know, there is two medicines, two eras of medicines. One before pandemic, another after pandemic and vaccines. So what our colleagues are doing, they are not perceiving that there is something changed. They are applying old models with new diseases that are very similar to the old one. So rheumatic polymyalgia, I treat with this protocol, and the rheumatologist didn't understand how she became cured in 3 months. Normally this takes 1 year. There was this lady who she didn't get the shot, but she had an encephalitis. After encephalitis, she had some seizures. And then she got COVID, and then the seizures became more frequent. And then all the neurologists weren't able to control, to suppress with regular treatment. And then she had another COVID, and this got worse again. Well, she came me after 2 years of this. She looked at me. She came to me 2 years about this, and I said, listen, you have lost memory, you have tingling, you have headache, you have brain fog. This, I guarantee that I will help you, because I already had a lot of experience treating. Seizures, I'm not sure. You know what happened? 7 days after treatment, so there is no time to fix her microbiome. So 7 days he stopped convulsions, and I said, he stopped to have seizures. And then I think, this is not due to the microbiome. I said, well, maybe after encephalitis, that it was not from COVID, she had a focus here, that high concentrations of spike keep these seizures. I thought of myself. So when I gave nattokinase and I gave ivermectin, decreased these levels, and then it stopped the seizures. Okay, 4 weeks after our treatment, then she recovered. No brain fog, no tingling, all disposition were back. So showing, and then after one month, I believe that maybe the bifidus found their place over there. But what is amazing is that the doctors they are not understanding that, for instance, there is lateral sclerosis, lateral amyotrophic lateral sclerosis. Okay, you know the motor neuron in your spinal cord. In my whole career, I have 39 years working here, and before the pandemic, I just saw 3 cases of this in 35, 36 years. And now this year I saw 7. And the specialists, do you know what they say? They say, well, it doesn't look like a regular one. It's a little bit different in some characteristics. The good point of this is that the previous disease, previous pandemic, they have a model, but most of the time we don't know the etiology. Maybe in this case now we know etiology because we know that the spike, there is a paper called spikopathy, they create inflammation and they harm the brain system, they harm the nervous system. So what I'm seeing with all these cases, they look like miracle, but I saw 100 not with so emblematic disease, so impactant disease, but I saw a lot of just with this mild post-spike syndrome, and they are all improving. So I count on you to do a paper, a work, a clinical trial that they can't come after me because they look at me, he's just another doctor.
Well, I think it's important to test, right? So I think if you're going to start someone on your protocol, and call it the Dr. Zeballos protocol, we should baseline before and after. I know you don't need the recognition.
Yeah, I'm 65. I'm above all this vanity stuff. I don't care.
Yeah, you and I, we work for God. We don't work for fame, and we don't work for money. I mean, we work for God.
But you are famous, and I became famous here
listen,
in Brazil.
I do not want this fame. Okay?
But this wasn't our goal to be famous. My goal is to put my patient above everything.
100%. We had to step into the limelight to tell the truth, to show courage, to encourage other doctors to be like us, to show the way. And unfortunately, it takes courage. It takes courage to give that call, right? To say, take 36 milligrams of ivermectin, right? And like you said at the beginning, we did it with our heart. Our gut told us that was the right thing to do. Yes. When I heard this patient was heading to the hospital, I said to myself, I failed him because I put him in a placebo-controlled trial. He trusted me to save him. I put him in a trial because the FDA wants me to do placebo-controlled trial. And I felt bad for this patient. And then as he went to the hospital, I felt like I was going to lose him. So my first instinct was to take on courage and say, you know what, take the 36 milligrams of ivermectin, right? And I'll tell you, the whole thing for me during the pandemic was really observing the miracles of God. Because that was God showing me, look, you're panicking about a guy. You've been watching him. You weren't at the pool or at the spa. You watched the guy from like 9 a.m. to like 2 o'clock in the afternoon when he ended up in the ER. And I'm going to help you save him, right? Because when you take away your time that should be enjoying life and you're giving it to help someone else, God pays attention to you. God gives you back. So you get back, and I'm still standing this pandemic because I really believe, God was watching me, and God opened up these doors for me. And I got to tell you, when we looked for COVID, it was a shot in the dark. It was, I had to make a call of spending $125,000 that I didn't have to analyze stool samples of patients with COVID. And without knowing whether I was going to find them or not. And my scientist thought I was crazy. He said, you're going to waste $125,000 for nothing. And on Friday, he said to me, guess how many stool samples had COVID that were positive PCR? I said, I don't know, 20%? He goes, 100%. That was the power of God that showed me the way. From there, I said, well, let me look at the people with COVID. Again, another paper that was over 200,000. And basically, I jumped in and I said, I'm going to look at it. And that's when I realized, wow, bifidobacteria is important. And then I looked at my database, looked at the kids had a lot of bifidobacteria, old people didn't. So it became one thing after another, and it really became the miracles of God showing the microbiome. Think about the fact that the answers of disease are in fecal material. God has a sense of humor, is all I can say, because nobody would look into that. Who would go in there to analyze stools, which is disgusting, by the way? No. And I do it every day. I mean, I went on a safari, and instead of taking pictures of the animals, I collected the stools of the animals. Who would do that?
You.
Unless you know there's something there and God is putting you on a path. So to me, it was really the path of discovery. It was the path of healing. Like you, I didn't lose anyone during the pandemic. I saw miracles. I saw treatment work. You cannot take it away from me. You cannot take what I lived during the pandemic. And the reason I'm out there and I'm speaking and I'm so vocal, and I tell all my patients, by the way, because people come to me for all sorts of things now, because, of COVID, people find me and they're like, well, let me have her look at my microbiome. And I tell them, I go, this is research. I don't know what I'm going to find. This is a relationship between you and me, and you have to understand that I'm doing research to understand the microbiome. And if we find an improvement in your condition, it's a breakthrough status, right?
Yes, it's amazing. A new universe for me. I didn't have any idea. I learned with you, and I see a strong potential in solve a lot of diseases.
So many, yes. Yeah. And it starts really, I say this, all disease starts in the gut. And all disease starts with the presence of a certain microbe, and all disease and the absence of good microbes.
Let me tell you something.
All disease starts with absence of good microbes, and we have to start paying attention. When we looked at loss of bifidobacteria, we noticed that it was absent in autism, it was absent in Alzheimer's, it was absent in anxiety, it was absent in bipolar disorder, Lyme disease, Crohn's disease, long haulers, long COVID, vaccine injured. So invasive cancer, you ask yourself, is the patient having an invasive cancer because the cancer is maybe microbial to begin with? Think about HPV causing cervical cancer. Think about EBV, Burkitt's lymphoma, H. pylori, gastric cancer. Is there an overgrowth of a certain microbe causing the cancer, and therefore a lack of good microbes suppressing that cancer? Is cancer the reason of cancer because a person is having some microbes in them, and then when they lose their immunity, when they lose their good microbes, that microbe is allowed to grow now? So think about the guy that lost his wife and is tremendously upset, tremendously stressed, is not eating properly, is not giving the right nutrients to this microbiome, has a microbe that probably could turn into a cancer, decreases his good microbes, the bad microbes goes up, and there you go, cancer. That's how I believe all of them occur. We're at the beginning of this. This is an exciting field, but I'll tell you, a huge breakthrough for me was, and I've had a lot of breakthrough, fecal transplant, but a huge breakthrough was transforming the microbiome of these two twins, isolating the microbes in those two twins, and finding out the possible culprit of their autism. They were severely injured, nonverbal, and aggressive. Twins, identical twins. We isolated the same microbes in both twins. What's the likelihood of isolating the same microbes in twins that are identical, right? When you're doing a pipeline that is looking for trillions of microbes, right? And then we found loss of good bacteria in those two twins, identical. We corrected their microbiome. We showcased their microbiome after. And guess what? With the improvement of the microbiome, the kids are now speaking. They're non-aggressive. The mom thinks it's a miracle, okay? And it's fascinating because, you know, when you see that, you see two concepts. You see the concept of the microbiome is improving, so you see black and white, and then you see the clinical picture. And now you cannot say, well, this is coincidental.
No.
Well, it's coincidental maybe with the clinical, if I didn't know, but I saw the microbes. Remember, there's trillions of microbes, and we isolated a couple of the microbes that were elevated identically in the two twins. I'm sorry, that's not coincidental. That's, you have A and B is showing one thing, and you have A and B is showing treatment there. It is science. It is science at its finest. And that's what I want us to go to. Listen, there's a purpose for pharmaceutical companies, right? And drugs. Ivermectin is a drug that was brought by a pharmaceutical company. All these drugs, we need pharma. We need pharmaceutical companies to continue to develop and distribute products to the market. But we also need pharma to let doctors innovate and say, maybe we use this drug that the pharmaceutical company is bringing, and maybe we optimize the gut to give it that balance, right? What did we do with COVID? And what did I do during my sickest of the sickest patients? It's interesting because you didn't use hydroxychloroquine and you used Solumedrol. And I used hydroxychloroquine, but I never used Solumedrol. Isn't that funny?
But because we start treating from the beginning.
It all depended.
When there was lung inflammation, then I start to use it. But when I treat the patient from the beginning, I did not have to use the Solumedrol because there was no inflammation. But there is a point that I think you're gonna love that I'm gonna tell you right now. I believe that we are all linked, we are all together, and energy. When I talk to my patient with confidence, I can't stimulate his energy, and he has the power to cure himself. So I believe in energy. And bacteria, I think they live with some vibration, with some frequency. And let me tell an example that is very important. My mother was...
And the brain, by the way, the brain controlling the gut. The fact that you're holding the patient and telling him you're going to be fine, that's reassuring. That's not playing, but that's helping the brain convince the gut that they're going to be fine. I think that's also a huge part of the healing process.
And let me tell experience that my mother used to be a yoga teacher, and she used to energize mentalization a water, and she put a lemon in this water. And the other water that she doesn't meditate or put any energy, you know what happens? The lemon that she put energy never got bacteria inside. It was like a wood. And the other one get with all this bacteria, showing that the energy, the thoughts, and now I'm going further, the emotion can control your microbiome. I believe in this. I can't prove. But
no, listen, it's like manifesting, right? The art of manifesting, right? If you manifest something, if you still obsess. I had a patient one time and he would come to my office and say, doctor, I'm going to have rectal cancer. I'm going to have rectal cancer. And he never would do a colonoscopy. And I would say to him, well, if you're worried about rectal cancer, get a colonoscopy. He would never do it. And then finally, one year he comes and he's finally agreeing to do a colonoscopy. And sure enough, he has rectal cancer, right? So what happened there? Did he manifest himself having rectal cancer, or did he know deep down he was going to have rectal cancer and therefore was scared of having a colonoscopy? The power of the mind is unbelievable. And here we are in a world where we're basically, transmitting waves, right? Images, by cell phone, by frequency, right?
Yes.
So there is a power of, and by the way, frequencies in the wrong hands could be very dangerous.
Yes.
But we have the power, in my opinion, to modulate the gut. Think about with frequency. Think about sound waves for healing. When you listen to a piece of music, you're calmer. And then there's that music that just gets you irritated and you just want to, like, throw things off the wall. So the music, the frequency of sounds have a power.
Yes.
And the meditation, the brain controlling the gut, the brain saying to the gut, you're going to be fine, calm down, right? So many of my patients, and when we discovered, by the way, leaky gut in anxious patients, which was essentially high Bacteroides, low bifidobacteria, we discovered these patients were they were anxious from having the virus, right? So when a patient is anxious about the virus, is he increasing those bad bugs? And therefore, creating those bugs to travel the nerve and go to the brain and create more anxiety and not allowing them to sleep. So is the anxiety the first thing, or is it triggered by the brain that tells the gut to increase these bacteria? Or is it the gut that has been depleted of good bacteria and therefore the bad bacteria are climbing up?
I'm gonna guess. I think start here and then the damage here keep with all
I
this.
think, yes. I work with a lot of patients, and I work with Dr. Amen and Amen clinics in LA. And we work with a lot of anxious patients, him and I. And he works on the brain, I work on the gut. And Ebony Cornish, all these doctors from the Amen clinic, I essentially work with them because I tell my patients this: I can fix your gut, but if you're going to demolish it with the brain, I can't fix that. I'm not the therapist. I'm the girl that plays with poop and can modulate your poop.
Of course.
I'm not the girl that's going to sit with you and figure out your deepest trauma that you've had that are keeping you in the state of perpetual damage, right? So damage.
I understand that. You're right. One thing that bothers me today with all the way that the medicine is going is that all the doctors doesn't try to solve the problem and to teach the patient how to have a good life. Instead, they just, if the guy is fat, they give metformin, they give Ozempic. If the guy has high blood pressure, instead asking him to lose weight, they give medicines. So it's something that I'm a little bit concerned, because the patient goes to the doctor and keep receiving 5, 7 medicines, and the pressure decreases, doesn't lose weight at all, but it doesn't solve the problem of the patient. So the medicine now is more orientated to give medicines instead to treat patients.
Right.
And there are some patients that I talk to them, and we call the key change. You open your mind, and then they start to do all the good habits, and they improve, and they throw all the medicines away. Let me tell you something. There are people who come here, they are not able to sleep, and they pass through a lot of neurologists, they're taking 5 pills, and I look at him and say, listen, of course my medicine is obviously that it can help you. And then I send to my kid, Louisa, she does theta healing, in which you work your mind, and then and then she's fixing all these guys and they don't need medicine anymore. But
That's amazing.
there is no incentive for this because the
Well,
future, yeah, the
the medical field has changed. The art of medicine has disappeared.
the lost art of
You know,
healing.
and it's corporate America right now, right? We're working towards corporate America, and also, the problem is in America, it's lawsuits happy, right? So a physician is always scared of being sued for doing something, so they're going to follow these guidelines. So think about it. The field has been they drove doctors towards being fearful of practicing the art of medicine, following guidelines because the guidelines is the box, right? So you can't even step outside the box. And on top of that, they only pay you a certain amount that you can only see them for 10 minutes. So what are you going to learn in 10 minutes from your patient that you're being paid? The overhead of a medical practice is between 500 to 1,000 an hour. And so if you're getting $40 for that 10-minute consult, multiply how many, patients you have to see to pay that 500 to $1,000 overhead. And then next thing you know is basically you don't have the time to get to know your patient. You don't know if your patient was molested. You don't know if your patient is an alcoholic. You don't know if your patient is lost his job or having marital problems. How are you going to fix that person if you don't know the beginning? How are you going to fix the person if you don't know what drugs they're taking? And we're so fast at taking the drugs, right? And we say, okay, well, what medications, metformin, et cetera, et cetera. But then we forget we don't have time. And even the nurse practitioner or the nurse doesn't have time, or the MA, to take all the supplements that they're taking, to verify if those supplements are clean, to look at all the probiotics to verify if those probiotics are clean, right? By the way, and I have to kind of emphasize, you must have a good probiotic in Brazil, because here in America, the reason I'm having difficulty is because 16 out of 17 probiotics say bifidobacteria on the label and do not have bifidobacteria in there.
Wow, good to know.
So probably in Brazil, there's actually someone that's actually verifying that there's bifidobacteria in the probiotics.
You know what? I have the results, so probably you're right. But there are some patients that I treat in US and in Europe, and I just orientated them. I'm orientating them by the label. So now I'm a little bit worried with them.
Yeah, so that's why testing before and after helps you a lot, in my opinion.
Yeah. No,
this is what I do
perfect,
because
it's a very expensive here.
oh yeah, it's very expensive here too. Trust me. But some patients want to do it because they want to see whether they're improving. Listen, when I killed my bifidobacteria, I was testing on a weekly basis, so I didn't care how much it cost because my microbiome is very important. It's definitely more important than a Taylor Swift concert ticket. So, I think we've, in society, we've put money towards the superficial things like going to a concert, buying the newest cell phone, and we forget that we need to fix ourselves first and our guts. So we need to prioritize. I think the problem is, like I said, medicine is so, 10-minute visit, you don't get to know your patient. It's important to get to know your patient. And that rapport, that
you need to have a connection. If you don't have a connection.
And the worst thing is, as we're heading towards this corporate America and guidelines and everything, my fear is that we're going to be replacing the doctor with AI, a robot. The last thing I want is to have a robot telling me what I have for a disease and give me a laundry list of medications that I need to take, and not holding my hand through the disease process. You need the human connection. There's nothing better than that. Giving a hug to a patient, convincing them they're going to be fine.
There is this video that when millions of people watched it, I gave an interview to a show here in Brazil, and they asked me about the future of medicine. And I told them that my diagnosis that I love to do, I love to observe and conclude, will be replaced by algorithms. The surgeons will be replaced by robot. But love, attention, connection, stimulate your patient that he's able to cure. For instance, if he has 30% of chance to cure from a cancer, I tell him we have concrete chance to
Yes.
cure your cancer. So love, attention, and protect your patient.
Yes.
This will take longer to a robust replacement. So as
I think
you,
love is the answer for sure.
yeah, as you and me, we're gonna still have our job even after
Oh,
yeah,
yeah, yeah, yeah.
yeah,
I'm not, we're dinosaurs, but we'll stay dinosaurs because
yeah,
I
but
didn't step into this field to be
yeah,
a robot.
yeah, we are
And nobody wants to just do the same thing over and over again.
yeah,
To me, the beauty of medicine is these discoveries, these breakthroughs, these innovations,
understand,
these
yes.
connections. Yeah.
Yeah,
So
I'm very
fascinating.
lucky, and I believe that the major role of the doctor of the future will to change the perception of your patient, because we perceive what we with our emotions, and if you are afraid, you have fear, and the doctor finish the fear, break the fear, then this perception change. You know
Yeah.
that some patients come here sick, and even before I start treatment, they say, "Oh, doctor, thank you, I'm cured," and I did anything yet. But it's
Right.
because I just
You gave them
showed him.
confidence.
I was confident because I know I can't lie to them, but I was confident. And when I do this and he believed in me, then there is. Did you ever hear about Bruce Lipton? Because this explains my experience that the biologia de crença, biology of beliefs. And when you start here, we are energy and yourself, and then the patient start to be cured. So the words of a doctor, as much with confidence and telling the truth always, has an endless power to cure even before we start medicines. That's what I
Yes,
believe.
I agree.
Because
I
I'm here
agree.
38 years old, 38 years working here, I can see this. Doctor, before we finish, that I need to see a patient in the hospital right now. Probably he has malaria. Imagine, I saw malaria very often, but he went to a farm and now he has high hemolysis, and I'm gonna treat him.
Wow.
And but
Wow.
before, I like that, if you want, of course, check the paper that I'm sure that you published it at
Yes.
ID
Yes.
cases, and see the protocol, how lucky I was. And then no, yesterday, I sent our art to Peter McCollum, and he asked me why bifidus is so important. And then I sent this paper with a review, and there is bifidus reducing inflammation, there is bifidus diminuing when you put in the nose, it's decrease the viral load of influenza, and it recover the filter of the intestine, the gut barrier. So a lot of things this
Oh,
bifidobacter.
bifidobacteria, is very important in breaking down sugar. And, everybody talks about mitochondria, mitochondria here, mitochondria, but guess what? You don't have a mitochondrial function if you don't have sugar in the mitochondria, right?
Of
In
course,
the ATP.
ATP,
Your
yes.
ATP is not working if you don't have sugar. So you need the bifidobacteria to break down the sugar to begin with. If the sugar never gets to the cell, well, your cell is not going to work properly. And it's the same thing, it's every microbe has a function. Some break down potassium, some break down vitamin B, some break down calcium. So, some allow calcium to get absorbed, some allow, vitamin B to get absorbed, potassium to get absorbed, not break down, sorry. And those microbes are important. And so we must understand them better. And this is my path,
I
essentially.
have a question for you. In this microbiome, with people who has this post-spike syndrome that called this way, uh, they have zero bifidus, but they also have zero archimandia. I'm not familiar.
So actinobacteria is the phylum that contains bifidobacteria. So if you remember, there's phylum.
Is that the name of the bacteria? Archimania? No, Archimania. I'm not sure.
You're
This is a
talking about
big.
actinobacteria phylum?
No, no, maybe Zarchimania. Pergunta para Dani se tá. E Dani is my nutritioner. I'm sure she's here because she saw this, and I like to know if you know anything about, because these people come with high antibody levels to spike.
You
Let's
mean
say
acromencia?
acromencia, maybe, yes, maybe.
Yes, yes. We have a data. I'm not going to say too much on acromencia, but we have data coming out on acromencia.
Oh yeah, because a lot
Oh.
of trillion. But I believe that the bifidus is the big boss in the gut, and I can see
Well, I think so too.
like small war. There is small war, and
Yes.
when the bifidus bacteria come, it fixes
It
everything,
decre-
because it's such a coincidence our results that I can't deny my result. That's why I ask you to explain, and let's go.
So here's the thing. If you start doing a lot of treatment, especially in the long haulers, you start different, in medicine, we like to differentiate, right? Like what is the beginning, right? If you look at the long haulers, for example, and we're going to call it spike protein injury, whether spike protein injury from messenger RNA vaccine, whether spike protein injury from the virus, you have to ask the question, is is it from a leaky gut that started to begin with and therefore got worse with the virus, and that's how the virus penetrated? You have to ask, did the treatment kill the virus but also kill the gut? And therefore, my patient now has an imbalance in the microbiome. You have to ask, is the virus still present? And therefore, we've picked up the virus in people's stools up to a year. So they had COVID in 2020, and then
But
a
this
year
is a
later, we still picked up.
It's a bacteriophage.
It's a bacteriophage, exactly.
Yes, sorry,
And then there's also the spike protein that's remaining. So you could have the virus is no longer in the stools, but then the spike protein is remaining. So there's multiple levels at to, when I treat my patients with long haulers, I like to know, is the virus still in the stools? Is the spike protein still in the stools? Is the bifidobacteria gone? And is the bifidobacteria gone because of the fact that they it got killed by the medications, or did it get killed by the virus, right? And then the other thing that's important when we look at treatment is, does my patient need to continue on treatment for the rest of their lives taking these probiotics? Because these probiotics are not implanting. Are these probiotics implanting? Because the goal is to really restore the gut to where it was before the viral infection.
With diet
Before
also.
the Well, diet, rest, relaxation, products, etc. But you know, if you don't restore the whole process of restoration of the gut is really to get you back to where you were before you took that first antibiotic that killed your gut to begin with. If you take the history of the long haulers, they'll tell you, well, I took a lot of antibiotics as a kid. I had a lot of surgeries. I live a lot of stressful life. I drink a lot of alcohol. I use drugs, etc. So it's really important when you do that differentiation first, and then when you treat, to say, okay, I'm not going to just keep them on this. At some point, you want to wean them off to see if implantation occurred, to get them back to where they were. And that's really where I want us to go, to see what works that got us back, because then that's reversing time in a way. That's reversing to before the damage. That's fixing that broken glass. It's
So you
not
think
very
all
easy.
this start a long time ago?
Yeah, so the reason I said that with Peter McCullough, it's not easy to fix, is because ultimately you want to go back to a life where they didn't have to take anything, right? We weren't born to take pills. We weren't born to take vitamins. We weren't born to take shots. The whole concept of taking a shot every 6 months to protect myself from a virus is just ridiculous, because what happens when the next virus comes in? So now we're going to have another shot every 6 months, and then what happens? There's trillions of viruses out there. A tomato has a bunch of viruses. A pepper has viruses. Every time you go outside, you're exposed to viruses. Are we going to start vaccinating against every single virus that's out there? because it becomes potent because we've killed the good bacteria. We need to stop and say, stop killing, stop suppressing the gut, increase the bacteria, improve the microbiome of humanity, improve the microbiome of the planet, stop burning, stop destroying, let it heal, let it regrow. And then you have humanity can live again. At this rate, if you look at the microbiome of the Amazon jungle or Africa, they're so diversified. They have so many microbes that we don't have. You know, what happens when we're exposed to those microbes that we don't have? That's your immunity going into a flare up, right? Because your body does not recognize that microbe and starts developing an immunological response, right?
Yes.
So it doesn't so that's what immunity is, and that's why it says we say immunity starts in the gut. So, in essence, I think all of it works or none of it works, but we're on this planet to ask questions. I have a million questions. At some point, we'll find answers. We'll find answers to some things and not others. But I think the suppression of the asking questions is a problem. And, my role on the pandemic was not only to shine the light, and it was also to shine the light on the corruption that has happened in medicine and the censorship and the retraction of the papers that are controlled by publishing houses that are privately owned in Germany that control all the journals. So when you say to me, well, I'm going to publish, yeah, they're going to put you up there, they're going to let you publish, and then in about 6 months, they're going to retract the paper. That's not.
Dr. Sabine, this is my nutritionist.
Hi,
and,
doctor.
and she follows you. She loves you. You are a god for her.
Yeah.
And
I love my nutritionists. They know what it's all about.
And she helps because she creates this diet which make easier for a life of bifidus. So, and
Perfect.
that's what I need to tell you. There are some
We
patients.
We should connect because I have my own diet protocol.
Oh,
so
okay.
we should connect. So
That's
we
good.
can.
That's good. I'm gonna give you her zap.
That's
But
fun.
what happens? I need to tell you. There are these patients that I don't give even ivermectin. I don't give even a short course, and I give just the bifidus. But she fixes with diet and bifidus. Just of this, there are these cases.
Yes,
So
it is possible.
It's amazing.
It is possible. I mean, think about what is a yogurt? It's fermentation, right? Which is a bacteria that's in the yogurt. So food has the power to heal. Think about our vitamin C, where that's coming from, our fruits. The problem is when you put pesticides on the fruit, you're killing the ability to have a vitamin C, right? So I think, and it's too much. I mean, we do too much. I mean, I go through these fields and they have like enormous machines that are basically spraying gallons and gallons of these pesticides. When you look at the product, there's a skull and it says do not drink because it's poison, but yet they're putting it in our fruits and in our soil. It makes no sense. At some point, we've got to go back to more natural way of living. And God gave us everything in the planet. He gave us the honey from the bees. He gave us the fruits.
Yeah.
He gave us everything.
I have some fruits in my home here in São Paulo. That's a big town.
Same here.
But let me tell you something. I believe also, and is all what you perceive, your mind, your spiritual. I believe in God. And since I was 18, I meditate, visualizing what I want. Since I was 18 years old, I'm 65. I don't have any fat here. I don't have any fat in my heart, and I don't take any supplements because I eat well. It's very difficult because a lot of promotion, a lot of publicity in sell all these supplements. I'm not telling that some patients need to replace, of course, if they don't eat well, but it's not like this is to keep people younger. That's not true. What's keep people younger? It's optimism, and pleasure of life.
Yes, absolutely. But also, your foods are way better. I was in Brazil about 2 years ago. I was drinking a coconut every day, one or two
Yeah,
coconuts every
I
day.
have coconut
I
water
mean,
every day. Yeah.
that is the best. That is, I was addicted to it. My body was needing it. And actually, my microbiome was very much improved after. So, the quality of the foods is very important. We in America, unfortunately, have become a fast food
They are trying to
society.
fix this now, right? There is a lot of
Well,
resistance.
hopefully, the colors. I mean, there's too much garbage in the food. Part of the problem is they're trying to keep these products on the shelves longer than they are supposed to. So think about the milk. When you put a preservative in the milk, you're removing all the, value of the milk. I'm sure in Brazil they're not there yet. You know that if milk is only good for 1 week, you drink it and that's it. So I think, that's the difference. Argentina and Brazil, you guys are still doing it right.
Yeah,
The
I
soil
hope
is
so.
great.
I hope so. And
Well, that's all your government, so hopefully they won't be bought
no, our
to
government
fund the pharma.
is not as good. I wish it was. I hope that
Yeah.
we have a change here. But for me, no problem. I feel sorry for the people who can't afford the good
Yes.
food. And let me tell you another thing. Uh, when you have a purpose in life, and I believe that our purpose is to improve ourselves after we win all the challenges that, and then you became a better person. And you
Yes, yes.
said that I need to have a courage. Yes, I had a courage here. I said what was better for my patient. Doesn't matter if they say, but for me it was easy because I own my clinic. I have my private
Yes.
patients. I don't
Yes.
depend on university on
Yes.
university. I don't depend on money from labs. I don't depend on anything. So what I did was put my patient at first. So I think I
Yes.
wasn't that coarse. The people say about bad things about me, those fact checkers, but I ignore them. They look like Lilliput people nicking my chin, and I don't perceive anything. So
You
that's what
know,
I think.
you keep moving, keep saving lives. That's what matters. And at the end
Doctor.
of the day, look at you. You're still standing after COVID. You look great for 65.
Oh,
So
yeah.
bravo,
Well,
bravo.
thank you. And I unfortunately need to see my patient, but
Yes.
I like that to check our protocol because one thing I know, I don't know how and why, but it works incredible, amazing results. She follows me, amazing
Yes.
results, and maybe the biftus is a big boss in the
I
next
think
season.
your key is your nutritionist right there. It's probably optimizing their guts.
Listen, yeah, maybe because I lose some weight with her, but
Meditation,
I think
optimizing.
meditation and more. Love, love your
Yes.
life, enjoy, and don't feel
Yes.
afraid to do whatever you want.
And give confidence to your patients that they're going to be okay,
That's
because I
it.
think that's the most important is they're going to be okay. Follow the protocol, you're going to be fine. That holding a hand, because when you lose that contact with the patients, they don't have anyone to go to and they panic, and that just makes their disease even worse. So I think congratulations, you're doing fantastic.
Congratulations to you.
Thank
And
you.
let's see if you are able with all your structure. Let's see if you
Yes.
make a clinical trials with this protocol. I know that it work, but now we need the evidence that I know that it work.
Well, I mean, let's raise some money in the foundations and let's do it. So, if people want to spend some money on this protocol and help us do it, that'd
I
be
can talk
great.
to some billionaires here. I'm gonna see.
Perfect. That'd be great. Yeah, it wouldn't cost that much. I mean,
No,
probably.
yes, I'm not asking their billion. Maybe a thousand,
Yeah,
couple
like
thousand.
50,000, 100,000. It wouldn't cost that much, but I think it would be a very important protocol. I'll tell you one thing I would love to do is to look at what nanokinase does to the microbiome on its own, just to see, is it removing the spike and is it doing something to the microbiome or not? I'd
Because it
love to
comes
see
from
that.
soil. Maybe there is a
maybe
correlation.
maybe
Yes.
there's a benefit to it. So,
Yeah.
we saw ivermectin. It'd be great to see nanokinase. So let's work together.
Well,
I'm excited.
me too.
And
I hope you read. It's just 9 pages.
Yes.
There are papers that I mentioned, your paper on the study. And sorry about my English, but I bet we're
Your
gonna
English is fantastic.
let me, and I bet that if has to publish a paper with more details, this will happen. We don't need to push. Just keep going.
Absolutely.
Okay?
Absolutely. All
So,
right. Thank you
so
so much.
all the best. Love to talk to you. You were an
Thank you.
inspiration when I create this protocol.
Oh, good. I'm very happy. Thank you. That makes me
Nice to
happy.
My
meet
pleasure.
you.